Continuing our discussion on men's health, we learned earlier that there might be a link between sexual health and overall health. So the question is, what is the real link between sexual dysfunctions and heart disease, diabetes, and other men's health issues? Dr. Fish.
Well, you know, it's interesting because there's a heart hormone connection. And as we say, erectile dysfunction, problem with sexuality, is a barometer to men's health. What's amazing is that if a man has erectile dysfunction, it could precede a medical problem by 2 to 8 years, which is quite impressive.
Let me ask you this question. So you're telling me that if a middle-aged man comes to you with erectile dysfunction and at the same time he did not have heart disease, this could be a predictor of future heart disease?
Absolutely. It's a risk factor for heart disease. So it's important to know. And the bottom line is a lot of this revolves around testosterone. It's an amazing inverse relationship between testosterone and heart disease, diabetes, a lot of factors. And we now know that testosterone is very important for libido and sexual function.
Well, testosterone does play an important role in both of those. In addition, erectile dysfunction is really caused by blood vessel problems and nerve problems. So as a man is developing those symptoms or risk factors for cardiovascular disease and having resultant nerve problems and vascular problems, that's what really causes the erectile dysfunction. So the same medical problems that are causing erectile dysfunction, in addition to the testosterone, but the nerve problems and the vascular problems, those are the things that start to signal nerve problems and vascular problems elsewhere in the body, like the heart.
Well, you know what I find fascinating? Is that you can tell in the street the people that have erectile dysfunction and heart disease. These are the people that have big bellies. The bigger the belly, the lower the testosterone, the higher the chance for diabetes and high blood pressure.
So what is the link? Why do men who have what we call abdominal obesity in our medical language, or fat in the belly, why do they have more risk of having low testosterone?
Oh, it's very simple. Testosterone is broken down in the fat cells of the body, except it's accelerated in the fat cells of the belly. It's called aromatization. So testosterone is broken down to estrogen. So if you're overweight, you have that big belly, if you can't see your waist, you are at high risk of having low testosterone, erectile dysfunction, and guess what? Diabetes, high blood pressure, and cardiovascular disease.
In addition, a man who is obese is more likely to have what we call the metabolic syndrome.
What is the metabolic syndrome?
The metabolic syndrome is a combination of, or a constellation of symptoms that include abdominal or truncal obesity. It includes elevated triglycerides or fats, high blood pressure, and sort of insulin resistance or the initial development of diabetes.
It's a bouquet of a number of diseases or conditions. Is that what the metabolic syndrome is?
The metabolic syndrome is a combination of risk factors for cardiovascular disease. And as Dr. Fish has already mentioned, we know that men who have low testosterone are more likely to develop this constellation called metabolic syndrome.
Well, this reminds me of a question that was submitted on our website, www.drridwan.com. And the question came from Alexandra in Russia. She said that her husband, who is 60 years old, had erectile dysfunction, and he actually took the oral medications such as Viagra, Cialis, and Levitra, and they worked for a few years, and in the past 1 year she noticed that these medications were not working well. What could be the causes of erectile dysfunction medications not working well?
Well, it's pretty straightforward many times. You know, it happens all the time that these medications, the oral medications, don't work well. And they don't work well if you have a low testosterone. If you have a low testosterone, you're really kind of sluggish, not into it, the libido is down. Guess what? Those oral medications are not going to work well. So you really have to increase your testosterone to make those oral medications work better.
Also, as men age, they develop more nerve disorders and more vascular disorders. Their hypertension or high blood pressure gets worse, their cholesterol or fat gets worse, and that causes more blockage of blood vessels, and therefore the erectile problem or erection problems get worse, and the medications don't work as well.
Thank you very much, and many thanks to you for submitting questions on our website, www.drridwan.com. And we just heard about the significant link between sexual dysfunctions and overall men's health, including cardiovascular disease and diabetes. Stay with us for more on men's health.